Welcome to Medtalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, Medtalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with Medtalks, where every talk is a step towards a better you.
Grace Med Health Clinic is your home for complete, compassionate care. From medical visits to vision screenings, dental care, behavioral health support, and a fully equipped pharmacy, we're here to meet all your health needs. Our dedicated team of providers and staff work together to make every visit welcoming and stress-free. Because at Grace Med, you're not just a patient, you're part of our family. Call 316-866-2000 to schedule your appointment. Grace Med Health Clinic, compassionate care for all.
Hi guys, welcome to another episode of Med Talk. My name is Juvenava. I am the Director of Community Outreach and Communications here at Grace Med. I have the wonderful pleasure of being here with Danielle Ramirez. She is with the Tobacco Free Wichita Coalition, which is part of the Medical Society. Hi Danielle, how are you?
Hey, I am well. I'm glad to be here.
Thank you so much for coming. Tell me a little bit about yourself.
Sure. So I am currently the Tobacco Control Coordinator for Tobacco Free Wichita Coalition, as you mentioned. But I'm also a mom of three, and I also run a hybrid publishing business called Quiet Storm Services. So
That's awesome.
I've been in substance use prevention and community organizing and community work for almost 20 years. And so I was really excited to begin work with the Tobacco Free Wichita Coalition just a little over a year ago now.
That's so cool. We had a chance to connect through, obviously, the work that we do in the community,
Yes.
through community outreach. And I'm very interested to know more about the Tobacco Free Coalition. What does that entail? Like, what's the mission of that coalition?
Yeah, so the mission is basically to reduce the harm associated with tobacco use in the community. And so we're really excited to partner with Grace Med through the community endeavors to just spread the word about what the coalition is up to these days.
Yeah.
The coalition has been around for over 50 years.
Yeah.
It's actually the oldest coalition in Kansas.
Oh, wow.
So it's been around, I don't want to say as long as tobacco has been, but nearly.
Yeah.
And like you mentioned, tobacco-free environments is a really big part of that. But what we don't hear as often is about the use of e-cigarette and vaping with young people, and how tobacco and specifically cigarette use is trending upwards with specific groups. And there's some pretty significant disparities that exist with some different racial groups and among people with mental health and behavioral health issues.
Right.
So it's actually climbing with those groups. And then, low income communities and people who demographics who have been intentionally targeted by tobacco companies, unfortunately.
And you mentioned a good point. One of the things that we've noticed out with our patients is that most of our patients are underserved individuals who are uninsured. Their income is very tight, right?
Yep.
And we see that they use smoking or even vaping as sort of like to calm their stress down or to even calm their anxiety down. And so what are some resources that the coalition has available for that community, for the people that we serve, that can help them fight some of those anxiousness that cause them to smoke?
Yes. So this is, I think, a good part for me to jump in and say that I'm a person in recovery from tobacco. So I quit smoking 4 years ago.
Congratulations.
Thank you.
Yes.
And the health benefits I've seen from that are tremendous. But I had been under the impression, too, that it was something that could help with anxiety.
Right.
And it's just not true. Usually the calming effects that nicotine has in terms of cigarettes is because you're taking that deep breath. And it's not necessarily the actual tobacco or nicotine. And in fact, nicotine is a stimulant, so it speeds up your blood pressure and heart rate, right?
Yeah.
So that story is what people have been told, is that if they turn to tobacco or e-cigarettes or vaping, they'll be happier, they'll be less stressed. And you see it all the time in the ads, right?
Yeah.
People skipping down a beach, holding hands,
Right.
vaping. The vapes have been turned into all different kinds of gadgets nowadays. The most recent one I've heard about is the e-cigarette looking like a highlighter
Yeah.
and actually functions as a highlighter. So
Yeah.
there's all kinds of ways that the manufacturers get around it. But I'm really, really glad that you talked about the resources, because there are resources available for people who want to quit. We are grantees of a grant called the Chronic Disease Risk Reduction Grant, and that's through KDHE. So we are really lucky to be connected with the Kansas Tobacco Quit Line. And they have a bunch of different specialized programs for people who are ready to quit or who are just interested in quitting. But they have specialized program for pregnant women, for teens called My Life, My Quit. They have it for American Indian populations. And the list kind of goes on. They've done a really good job of expanding to meet the different needs of the different populations who are using tobacco.
Yeah.
So.
I've seen the Can Quit
Okay.
sort of advertisements and like the brochures and things like that. We have them in our clinics.
Oh, good.
It's obviously very important. We want to promote like healthy lifestyle and things. And it's interesting you talked about the vapes and how they're making them like so fun and gadgets. I recently saw one where it's like a video game, almost like a little game while you're smoking it.
Oh my
and it's just
goodness.
like, oh, this is not what we want for right now, be part of the coalition. And so with that, like if someone wants to be involved with advocating for a smoke-free environment or to help people not smoke, how do they get involved with the coalition?
Yeah, absolutely. A couple ways to just reach out. They can jump on our website, tobaccofreewichita.org, or get on our Facebook page, send us a message, send us an email, and I'll get them linked up. Our coalition meets every other month, so that's not too heavy for people who are, have a lot of meetings going on. But we're really in a phase where our coalition, since it has been around for 50 years, we're really in the process of reaching out to new individuals. We want to begin to engage young people and people who are in tobacco recovery, because culturally we're in this spot where, I've heard different coalitions say nothing about us without us.
Yeah.
So it's really important that our organizations, policymakers, and leaders at GraceMed and clinics include the voices of those people who've been most impacted by this issue. So reach out and we will get you involved.
Yeah, we would love for people to be more involved in such an amazing cause. You mentioned that the coalition's been existing for a number of years. What are the future goals for the coalition?
Yeah, absolutely. So we are looking at this from the most comprehensive view possible. So we look at working with treatment providers and clinics and what they're doing in their practice with clients. We look at what's happening on a city level in terms of ordinances. I don't know if you all heard that recently the Wichita Transit went tobacco free. They passed the Transit Advisory Board passed a policy in May.
Okay.
So one of the things that our work will entail is working with their staff to make sure there's proper signage and to make sure that it's actually being implemented, because policy alone doesn't solve the problem. We need strong enforcement also to help protect people's health who, children ride transit, high school students ride transit, pregnant women, like all the different people who are using transit, so that they have a smoke-free environment, tobacco-free environment.
And what are some things that right now you're involved in, or like some events that might be coming up, or maybe some policy changes that you're partnering up with or advocating for that you think should be important for our listeners to know about?
So we try to be out in the community, engaging with people, answering questions. But as far as policy goes, something that was that we have been working on and that we are working on is called Reduced Ads, Better View. And essentially what that is when let's say you drive from the east side of Wichita to the west side of Wichita, and you take a look at the gas stations, you'll see a difference in how ads are displayed in different neighborhoods.
Oh, yeah.
Based on, again, the disparities of race, low income, and there's targeted areas where you can see the ads going down from the floor all the way up to the ceiling, right? So why this matters is that we know that ads influence people. Even though a lot of people don't believe that ads do influence them, there's a lot of data that says it does.
Right.
What was really revealing to us, we engaged the community last year, and we had 2 photographs up. One of a convenience store that had a limited amount of ads, and then one that was just plastered with ads. And we asked people, which one would you rather see in your community?
Yeah.
So the vote was like 197 to 1. One person wanted the one that was plastered with ads. And can you guess what? It was a child. And we said, why did you want that one? And they said, look at all the colors.
That's interesting.
So the ads, and this isn't just for tobacco. This is unhealthy foods. This is, soda pop, alcohol, you name it. The ads that are targeted towards children and others creates that pattern of addiction.
Right.
And then ultimately impacts health. So we are in the process of looking at a content neutral policy, which would reduce the number and the percentage of ads that can be placed on storefronts.
Yeah. Well, and it's interesting you mentioned that because, I mean, we are living in an age where it's about influence and content, and that sometimes of how important it is to have content that doesn't look like you're marketing, but you are marketing. And so you're trying to figure out ways on how to like target certain audiences. And being in marketing now, you sort of realize how much companies do target certain demographics and certain populations and communities, so that way they can get the reach that they want. And I think people fail to realize that that's a very much on purpose. And I'm glad that you are working on something to help alleviate some of those, marketing pressures and stressors of that.
Thank you. There was, and we're really fortunate. We have some local marketing groups like 9 Associates and others who volunteer their time and effort to help us try to counter some of the advertisement that's been done. But there was a stat that I read, and I'm historically terrible with stats, so let's double check this. But I believe the tobacco industry spends $1 billion an hour at point of sale for tobacco. So we're kind of up against, some heavy hitters.
Yeah,
so
of
anything we can do to help people realize the impact is what we're trying to do. And if I can just add, we actually engaged young people through a process called Photo Voice, which is an evidence-based process where the young people, we ask them some research type questions, and then they go out in their community and take photographs of what they're seeing. And so we had some young people who participated in this.
That is so cool.
We partnered with the Mayor's Youth Council.
Yeah.
And then we were like, well, what do you guys want to do with it? What do you want to do with these photographs? And they said, let's do an exhibit. And they invited Mayor Lily Wu came out, and several city council members and a local school board member came, as well as parents and other youth. And they got to share their experience of what they see in the community as it relates to ads. So
that's really neat. I mean, that's incredible. That's really creative. Thanks. I'm glad. I love when coalitions get the community involved and that they show other ways for especially like our youth to get involved into just to see what's going on in our community. So that's wonderful.
Absolutely.
If people wanted to find out more information about the coalition, where would they go?
They can go to our website, tobaccofreewichita.org, and they can check us out on Facebook, X, LinkedIn. I think those are the main
All of
socials we
it.
have.
Yes,
Yes.
love it. That's
Yes.
awesome. So, Danielle, thank you so much. Is there anything that I probably missed or forgot to ask that you would love to mention to our audience?
No, you mentioned a lot of really great points and asked a lot of great questions. I think what I forgot to mention was that with the Kansas Tobacco Quit line, there are incentives that are
Oh,
offered. For example, for pregnant people right now, they can get up to 9 free coaching sessions
that's
with a
awesome.
coach, as well as a $40 gift card for each
Okay,
session.
that is really cool.
And there's free NRT, which is the nicotine replacement therapy, that
Yeah.
they can get hooked up with as well. So
And I think people forget that some of those things do exist to
they
like
do.
look for the information. I mean, even I mean, providers might not know that that information is available and those incentives are available for their own patients. And, it's important to make the audience aware of those things. And that's nice, especially that coaching part, because it's awesome to have someone to hold you accountable and to be there in that support system. So that's
Absolutely.
wonderful. I'm glad you mentioned that.
Yeah.
Well, thank you so much, Danielle. I'll see you around in the community.
All
Thank you for
right.
joining us.
Thank you for having me.
Yes. All right. Well, thanks, listeners, for being with us, and we can't wait to see you for our next episode.